It is Tuesday, August 25th, 2020. This is our COVID-19 Task Force update, and it is the 121st edition of our updates. That's how many we've done since the beginning of this pandemic back in March. On today's program, Lloyd Phillips, the Commissioner of Public Safety, will be here, but we'd like to start things off. Back from vacation is Lisa Westaway, who is the Executive Director of the Kateri Memorial Hospital Center, and of course, a member of the COVID-19 Task Force. Lisa, welcome back.
Thank you. Good afternoon. So I'm here to provide a few updates today. It's been a while since I've been here. The first is about inpatient. So I would like to just give a little bit of an update about visitation and how that's been going. So it's been a couple of weeks now that we've been having visits in patients' rooms. And again, family members have the choice to come into the room on the inpatient floor or to visit downstairs in the outpatient area. Those visits continue to go well for the most part. There are rules that are in place to ensure the safety of all involved. So again, we ask that you respect the rules that we've implemented because they're there again for everybody's safety all around. There are a few protocols that we are working on that will come into effect very shortly. So the first is the Caregiver Protocol, and this basically is a protocol for family members who were already providing a level of care, either psychosocial or physical, nail cutting, hair cutting, any type of care that they were providing before the pandemic. So we're looking at how to implement or re-implement Caregiver Protocol so that you can come back in and take care of your loved ones. So that will be finalized this week, and we'll be giving you more information as the week goes on. We're also in the process of finalizing a protocol so that your visits can take place outside, either in the front courtyard, which is just about ready for use. We just need to ensure the safety of the temporary fence, or where you would be able to take your loved one out for a walk on the bike path. So again, that protocol is being finalized this week and should be implemented next week, and I will keep you updated, but I wanted to let you know that that was coming along. Just a little reminder that visits are now booked through calling inpatients. So you as family members or loved ones have the responsibility to contact KMHC to book your appointment. And we do have appointment slots that are empty, so we have spots available for you to visit should you wish to. I also wanted to talk about food delivery. Again, just to remind you that during our bi-weekly drop-off on Sundays at the testing site from 10 to 1, every 2 weeks, you can bring food in, and that continues to go very well, and residents are really happy to have either homemade food or food from their favorite restaurant. So that continues to go well. A little bit of an update on numbers and what's happening around us. So it's been since early August. So if you remember the last time I spoke about numbers, we had seen that since June 30th, since Quebec had reopened all businesses and all type of establishments, that the weekly average of number of new cases was consistently rising. And that was troublesome to us. We thought that that could have an impact on different things within the community, and so we had postponed opening of gaming, we had postponed even the start of school, but since early August or really end of July, what we've seen is a downward trend. So the weekly average of number of new cases consistently is going down. That is a very positive sign. We also see that the R effective rate, and just a little reminder, we had discussed that in the past, that's the number of people that one particular person can infect or is infecting. So that rate is still below 1. So we have a very good scenario in Quebec right now for reopening or further reopening of different establishments or schools. So it's again an indication that we are in a good place, and it's a good time to move forward on those reopening plans. If we look at the community specifically, at the testing site here in Kahnawake, we continue to test, and we still have not, of those tested, we have not had any new positive cases. So it's been several months since we've had an active case in Kahnawake. Again, those are of the people who are coming in for testing. So we do not test many people, probably 5 to 10 per day, and closer to the 5-person number. And so we remind you of the importance, if you have symptoms, to come and get tested. And that is one of the main criteria for containing the virus within the community. So that's why our testing site is still open, why we keep it running, and we really urge you to call if you have symptoms to be tested. All of these areas, or our strategies, are working well. So a reminder of the strategy that we have in place. It's masking, distancing, and hygiene. Those three elements together are what contribute to the success that the community is having at this time. And we are having a lot of positive remarks, we see a lot of positivity around us about those elements, except for possibly the distancing. So we continue to get feedback, and we see around us that we are slacking a little bit within the distancing department. And really that is the element that is the most important in our strategy moving forward. And the reason why I'm talking about that is because we know that there is fear in the community with respect to school reopenings. And so we want to remind you of the importance of what you do on a day-to-day basis. So it's not the reopening of school in itself that could lead to an increase in cases. And what we see in the research and in the literature around the world is many of those increase in cases that happen as a result of school openings are actually as a result of people's day-to-day habits at home, and not necessarily what's happening in the school. So the reopening plan that we have in place, meaning that is respecting distancing, respecting masking, and respecting hygiene, ensures that we have safety within our school environment. But if we don't maintain those three aspects in our day-to-day lives, within our families and amongst our friends, then we can contribute to a rise in cases within the community and to outbreaks that could happen in different areas of the community. So it's really important to maintain those three elements at all times, and to continuously be mindful of those three elements whenever we're planning our day-to-day activities. So speaking about the school, I just want to give a little bit of a background of how KMHC is involved in the back to school plan. And a lot of it is hopefully going to respond to your questions about contact tracing. So meaning in particular, what happened, we get a lot of questions, what happens if there is a positive case in the school or a child with symptoms? So we've spoken about, during the pandemic, we've spoken about the regional public health team. So this is a Montérégie public health team that exists, and they're the ones who have contacted any community member who has been positive in the past. So over the past month or so, that regional public health team has been working with KMHC nurses so that we formally create a local public health team here in Kahnawake. That team is going to be working very closely with the schools in order to respond to any possible cases. So what that means is, so what people are looking for when they ask the question, what happens when there's a positive case? What we see is people are looking for a black and white answer. So I just want to explain a little bit about that process. We've spoken about it before now, but I want to remind you about what contact tracing is and how we decide whether somebody should be isolated or whether they can continue to go to school or go to work. So there's an assessment that's done whenever somebody is evaluated as positive for COVID-19. And part of that assessment looks at the level of risk, so the type of exposure that the positive person had with those around them, so the type of contact, meaning was it over 10 minutes within 2 meters, and the level of risk within that exposure. So meaning was were people wearing protective equipment, were they not? And so that assessment gives you a risk level, mild, moderate, or severe. And depending on that risk level, it would define the action that you take with the contacts around you. So whether it be with other children in your classroom, with your teachers, and that risk level is evaluated in all contexts. So it could be in the classroom, during recess, in the daycare, during transportation, in your day-to-day activities, and all the contacts are assessed in that same similar fashion. It's quite a lengthy process. It's confusing and it's difficult. So it's impossible to explain exactly what will happen in each case, because each case is evaluated on a case-by-case basis, and then a decision is made according to that process. So again, it's complicated, and I hope I explained it as simply as I possibly could, but what I mostly want to get across to you is the fact that we do have a local public health team that will be very involved with the schools in making these decisions. So we're working as a community, as we have from the beginning during the pandemic. We work all the community organizations together in order to ensure safety throughout the community. That's our main priority. We also have nurses who will be very involved in training of the staff, even working with the kids regarding how to use your mask properly, how to wash your hands, sanitary procedures. So there's a lot of collaboration that's happening right now in order to ensure safety with the reopening of schools. Lastly, I just want to mention that there's been many family members who have children who go to school here, or who have children who go to school outside of Gunawalga, are calling to speak with physicians about the possibility of being off work or of their children being off of school. So again, these are decisions for your physician to make depending on each of your individual situations. But just a reminder that being off work or being off school is really in relation to vulnerable situations. So if you look at the KMHC website, we do have a table there about what a vulnerable person is. And again, it's uncontrolled medical conditions, immunosuppressed conditions, which are very specific, related to very specific medication use, and being over 70 years old. And so should you be in any of these categories, we urge you to speak with your physician, and they will assess whether you or your child should not be at work or school. However, again, it's very limited situations that would put you into these categories. So the importance in protecting those around us who are vulnerable is not necessarily to not send your children to school. It may be, and again, that's for your physician to decide. But again, we have to remember that our day-to-day habits are what is most important. So again, just to remind you, masking, physical distancing over 2 meters, and proper hygiene at all times is what will protect those who are vulnerable, who are around you. So I'm just going to end off with a reminder of the bus safety procedures. We have a little video to show you, which very clearly demonstrates and prepares you and your child for using the bus. So we urge you to look at this today, but maybe to re-look at the video with your children so that they're well prepared as well. Thank you.
Mckay Transportation Department presents Procedure for Entering and Exiting Buses. Every bus will be outfitted with a protective plexiglass surrounding the driver, and every driver will be required to wear a face mask and shield. Social distancing must be maintained at every bus stop where students will be picked up. Students will enter the bus, one at a time. When the first student reaches the main level of the bus, the next student may enter. Students will fill all available space starting from the back of the bus. Every second seat in the bus will be marked off in order to provide adequate distance between students. Eating and drinking on the bus will be strictly prohibited. Two students may sit together, but only if they live in the same household. It will be mandatory for students to wear face masks while aboard the bus. All students are required to stay seated after the bus has arrived at the school. Students may begin to exit one by one, starting from the front of the bus. The bus driver or the bus monitor will assist with students exiting the bus. Any student with special needs that prevent them from wearing masks will have to arrange for alternate pickup and transportation to the school. Once the bus has dropped off all students at the school, the bus will return to the town garage to be properly disinfected on all its surfaces, including handrails, and seat coverings. At the end of the day, every school bus will be completely disinfected and washed from top to bottom. Following these guidelines and procedures will ensure the health and safety of all students for the new school year.
Good afternoon, and thank you very much for that video. I think it is something that is definitely worth repeating. I know we showed it last week, and by all means, you go online and you can watch it a couple of times and ensure that you're fully aware of the precautions being taken to keep our children safe. No, the reopening of the schools is obviously a major endeavor, and as Lisa mentioned, the date was pushed back, going back a few weeks ago. Before we bring children back into the school, we obviously want to be sure that we are as safe as we possibly can be. And I know there's still a lot of questions out there from parents and students, but no, there will be more information coming out as soon as it's finalized, and that will be done as soon as possible. We are encouraged by numbers within the province of Quebec in the past month or so. They've been very steady, and they've been actually on the decline compared to early on in the summer. And as also what Lisa mentioned, we had decided at one point to put a pause on any future openings of any gyms and any gaming establishments and actually even school at that point. But since we know we were getting more encouraged, we had recently give the green light for approval for gyms to reopen into the community. They are required to submit a safety plan to the task force. They are required to get that plan approved, have an inspection, they'll receive a health certificate, and then they are able to open. And that's still an ongoing process. And along the same lines, there was some great discussion over the summer and more recently regarding the gaming establishments in the community that are under the Gunawalga Gaming Commission. They were looking at originally opening in early August. It has been decided that they will be allowed to open on September 4th on a very limited basis, with very strict criteria. Starting off with the week one with the maximum of 50 people in the establishment, and they will further be breaking up their establishments into zones, which will be assessed on a week-by-week basis, and increasing the numbers, as we feel comfortable. Again, this is an effort to get as many Gunawalga and many people back to work as soon as possible. We are confident that once we reviewed the safety plans, once we reviewed the numbers within the province of Quebec, and obviously most importantly within the community, we are confident in taking this step forward. But mind you, it is a very restricted opening, And matter of fact, representatives from both establishments, Magic Palace and as well as Playground, will be here next Tuesday to give you an extensive overview of what they have put into place, what the task force has approved for them to venture down this path of a phased-in opening over a period of several weeks. So stay tuned for that. It's something that you'll see in the coming week. Again, we have to remind people that the ongoing opening of a business in the community is done in the safest possible manner. We keep in mind, as we always said from the beginning, about a holistic approach. We want to get people back to work as quickly and as safely as possible. And we have examples, throughout the community. In June, when we opened the retail sector, which included also a construction, within the community. Obviously, a lot of cigarette stores open, other construction open up in the community. There was a significant amount of concern, but we've shown that with proper inspections and people taking proper precautions within their establishments, that we could halt the spread of the virus, because since then we had no cases in there, and as well as concerns related to the schools. I said it last week, but it's worth repeating that step by step has been operated throughout the pandemic, and they have implemented very strict measures, took this very serious from day one, and they have been successful with 0 cases associated with having children within the same area, and as long as things are done safely. And the same thing can be said for Gunawalga Youth Center, who has been acting as somewhat of a daycare throughout the pandemic, and has been very successful in making sure that the children are safe. So these are all some of the elements that we look at, we weigh, and we say, okay, when can we take that next step? And we feel confident at this point, we could take that step forward in a safe manner. So our goal here is to keep moving forward in very safe, small steps, and obviously the health and safety of our community is paramount. And if there ever is a time where we feel that anything is at jeopardy, obviously the task force will have to reconsider any future openings and look at a revised strategy moving forward. But with that said, tomorrow there is a task force meeting. There's several things on the agenda to have a discussion. Mostly no plans about looking forward. Then certainly we'll be on the radio on Thursday morning to give an update on K103, and back here Thursday afternoon on Facebook Live. So stay tuned for that, and any additional information will be relayed. But I'd also like to remind the community as well, if there's ever major news or major announcements that need to be made, we do have Facebook Live that we could do any day of the week. But right now, we're maintaining Tuesdays and Thursdays. With that, Onigawahi, and I'll talk to you soon.
And thank you very much, Lloyd. We'd like to thank you guys for watching. I know that it takes time out of your day, but we do our best to make sure that you have the information that you need to get through the pandemic. And just a little story here to show you the impact of COVID-19 around the world. I'd like to thank Greg Horn of Uriweze for sending this over a few minutes ago. But the world's fastest man, Usain Bolt, has contracted COVID-19. That was announced just today. He's the world record holder, the fastest man who ever lived, and he has COVID. Even he couldn't outrun the virus. And what's even more, I guess, telling in this story is that just last week he had his 34th birthday, and he had a big party where no one was wearing masks. So, it's the same messages have been out there all the time, but when the world's fastest man can't escape it, then we have to take note of that. So with that, we'd like to, as I said, thank you for watching, and we shall be back on Thursday on behalf of all of us here at the COVID-19 Task Force. Nyauko Dano, Onigiwahi.